after the fall events, what are you learning from the fall events? So after every fall, we do a fall report and we say, was the bed alarm on? Did they have the socks on? Did they do this? So that checklist, but what I've seen so many times is people fill out a post-fall report, but they don't do anything with them. They just sit this over here in a stack of papers. And so where are you taking time to learn from the events that are happening, do the education? But education's one thing, but then how do you validate and standardize the work? How are you consistently doing what you say you're going to do? And I think those are the organizations that are really seeing some improvements with falls. I think you can do things to reduce the falls. I think there's things in the tactics and strategies that can help. But I don't think you're ever going to get rid of every fall. And the reason for that, too, is because not all the falls are from fall risk patients. So we do a good job of identifying who are the highest risk for a fall. But if you look at the numbers and the people that are falling, about a third of the falls come from patients that are non-fall risk patients. So, and that's where you get into the challenge of it, that you'll never eliminate all falls because we're trying to manage the high risk patients, and then this subgroup over here that you don't put all those extra attention to. There's still a third of those people that are going to contribute to the falls. The literature clearly states that preventing all falls is impossible. It's never going to happen. That's a little concerning, because then what I fear is that people get complacent and say, well, if you're never going to reduce all falls, then what's the point? We'll just do the best we can and the numbers will be what the numbers are. I think people have the best of intentions. I think nurses and doctors have the best of intentions, and I think patients have the best of intentions. Unfortunately, these people getting admitted to a hospital is not normal. You're in an environment that's not familiar with you. You're vulnerable. You're scared. You're on all these meds. I just think that there's a lot going on for the patients. In as healthcare workers, we want everybody to comply with what we tell them to do because we're the experts and we know what's best for them. Unfortunately, that doesn't always play out in the hospital setting, and we got to realize that and think differently about how we approach these falls and fall prevention.